What's up, guys? It's Dr. Jim. I am your CBD expert, your natural health care expert, and your worldwide virtual health coach. And I am here welcoming you to the live tonight. I'm excited because, I normally only go on live once a week, but this is launch week, baby. Launch week. I launched the world's first online health transformation program featuring CBD oil, and to celebrate that, I'm just giving out value like a Pez dispenser. All right, we're giving out value. Tonight's topic, because a lot of people question me about this all the time. It's CBD oil, chronic pain, and inflammation. All right, is that something people want to hear about? I'm sure it is. I get messaged about it all the time. So when you get in tonight, go ahead and put in where you're coming in from. Thank you. And whether you're seeing it live, so you're getting the full energy of Dr. Jim, or you watching it on the replay. But either way, I know it's going to be an awesome live, and you're going to get a lot of value out of tonight. But I want you to stay to the end because I want you to hear a little bit about the program. But I'm excited to give you some value tonight. CBD oil, chronic pain and inflammation. All right, so disclaimer before we get started. I'm not your doctor tonight. This is not a doctor-patient relationship. Please don't change anything. Don't stop taking anything. Don't do anything specific to your health because you heard me talk about something cool on this video. Number two is I do not claim to diagnose, treat, or cure any specific condition. But this is what is really, really cool, all right? Really cool, is that underlying every disease that has a name, there are lots and lots of little things added together that we would call a cause, all right? So I don't treat disease. I never have. I'm a chiropractor, man. But what I want to do is if we can go to a cause level and start treating causes of things, then that's what we want to do. And so that's really what we're talking about, but we don't diagnose or treat or cure any disease. But tonight, CBD oil. Yes, thanks for sharing. Go ahead and share it, like it. Tonight's topic, CBD oil, chronic pain and inflammation. Well, I kind of dived into the research. I wanted to see what's going on out there, what's the research showing us, and what we know is chronic pain. Well, so what kind of pain might be, chronic pain, or what you might be feeling? Now, if you have chronic pain, you can put it in the comments, and you could probably tell everybody in the audience a lot more about chronic pain. Okay, I kind of downplay it. I have some experience with chronic pain. When my wife met me in college, it wasn't a come on line, but literally every day I had to have her rub my knees. Because I had club feet when I was born. I've had, 5+ surgeries. I have scars all over them. And, I went to kindergarten in a wheelchair with hip casts. And I had multiple surgeries. And as you get older, man, it's painful. And, unless if you've had, anybody that has club feet or has someone in their family that has it, put that in the comments, because I'd love to reach out, because it's something I have a lot of experience with, obviously. But man, it left me with bone on bone, right ankle pain. I had to quit playing in the field in soccer in high school, and I had to quit running with the wrestling team, all in high school. So I was 17 years old, and they're like, well, you can't run anymore. All right, so since then, it had just been getting worse over time. So I know a little something about chronic pain. Now, maybe not to the level that any of you guys may know, okay? I had people message me earlier about multiple back surgeries and rods and just awful nerve pains and, degenerative and bulging discs and herniations and failed surgeries. So those are chronic pains. I get it. But what other things? So like arthritis. Arthritis can leave you with chronic pain. Nerve pain, joint pain. What are some of the ones that were down? Previous back surgery or neck surgery, all right? Muscle pain, fibromyalgia. These are the types of chronic pains that we're talking about. So, how possibly could CBD oil help with all of those things? Well, there's a couple ways that CBD oil works in helping. Once again, not treating a disease. I guess arthritis is considered a disease. We don't treat arthritis. But we know that underlying arthritis is inflammation. Arthros means joint. Itis means inflammation. So it's inflammation in your joint. So we know from the research that CBD oil has a very, very positive impact in the inflammatory process. Okay? So by affecting the endocannabinoid system, and you have to understand that on all of your immune cells, all right, tons of your immune cells, they have cannabinoid receptors on those immune cells. And CBD oil interacts with those receptor sites and helps bring balance, helps calm down the inflammatory response. So at the heart of a lot of chronic pain is itis, and we know that CBD oil from the research has a positive impact on itis. It helps balance out the immune system, bring homeostasis to the immune system so it can calm down the inflammatory response, and that's a great way to help with pain. Now, the next part would be another way in which CBD oil can help with chronic pain. All right. So once again, working through the endocannabinoid system. So this is something very, very interesting about CBD oil. Now, it's stoner friend THC. People really knew about that one because it was psychoactive, and people were taking medical marijuana to deal with chronic pain. And the reason they were doing it is THC affects CB1 receptors, which are in the brain. Okay, but it has some negatives too. So I'm not really going to get into that. But this is what's really interesting. CBD oil does not affect CB1 receptors in the brain directly. Okay. The way that CBD oil has an impact on our sensation of pain, because where do you feel pain, right? Where do you feel pain? Well, I hate to tell you, but your pain is all in your head. You're like, no, it's not. It's real. I promise I'm not making it up. No, your pain is all in your head. If your brain does not perceive pain, you don't feel it. Okay, so what I want everybody to understand is that pain is a brain processing. It's a sensation that you feel in your brain. If you clip the nerve going from your leg that goes to your spinal cord and goes to your brain, all right? If you clip that nerve and then you stab yourself in the leg, you will not feel it. You will not feel pain, all right? So you have to understand that your pain is all in your head. And there are tons of endocannabinoid receptors in the brain. Probably the richest of all receptors in your brain are endocannabinoid receptors. And this is how CBD oil interacts with it. CBD oil, it blocks or slows down or interferes with an enzyme. And the enzyme is designed to break down anandamide. Now, anandamide is a endocannabinoid. It's one of it's the joy bliss chemical that your body makes. It is one of the endocannabinoids that they discovered. Well, the way CBD oil works is there's an enzyme that naturally breaks anandamide down. Like it gets pumped into the brain, and then this enzyme goes and gobbles it up and breaks it down. Well, CBD oil blocks that enzyme from breaking it down. So what happens is your anandamide levels go up. And if you have more anandamide circulating through your bloodstream and in your brain, guess what? You feel less pain. All right? And that is awesome. All right? That is one of the coolest things ever. So not only can CBD oil have a positive impact on inflammation, which is one of the major drivers of anything itis and pain, but it also then it blocks how you perceive pain. All right, or it modulates is a better way to put it. It modulates how your brain perceives pain by interfering with the enzyme that breaks down one of your natural chemicals in your body that is the joy bliss chemical anandamide. I think that's just the coolest thing. So we can literally take CBD oil and help balance our immune system, balance inflammation, and take CBD oil it helps block some of the enzyme that's breaking down our joy bliss chemical in our brain and our body so that we perceive and we feel less pain. So the research on CBD oil and that. Now, not all of it's in human models, but in a European study in rat models, what they found out is that after 4 days of taking CBD oil, the rats, now they have ways to test. I don't know how they know rats have less pain and whatever, but they have ways. They know. And they found out that these rats, after 4 days of CBD oil, showed less signs of inflammation and pain, and so their mobility increased and their activity increased. That's pretty cool. Now granted, certainly could we use more studies on humans? Absolutely. But you know what? Almost all great studies, rats are a really good, who wants to be close to a rat? But biochemically, a lot crosses over. So it makes a lot of sense. Another study was done in Europe on MS. And this is why it's important, because in people with MS, one of the main places where their pain is coming from, it's coming from a certain amount of muscle tension, all right? Like spasticity in their muscles, because their nervous system isn't quite working the way it's supposed to. So they'll get really spastic muscles, and that will create pain. And what the research showed was that people with MS received a good amount of relief from taking CBD oil because it helped reduce muscle spasticity. So if you have, seriously tight muscles and they feel like they cause you a lot of pain, if you have fibromyalgia, guess what? That is good news. Now here's something else. What are some of the dangers? Because what's the current treatment for chronic pain and inflammation? Well, you can take anti-inflammatories like NSAIDs, like ibuprofen and all those other things. And then for really severe chronic pain, they give people opioids. All right? Well, guess what? What's the problem with that? Well, we'll start with just the NSAIDs because we think they're no big deal, right? But guess what? They are a big deal because long term, they wreak havoc on your stomach lining and your kidneys and your liver. All right? So that by itself we don't want to have. And number two is those NSAIDs actually interfere with collagen production. And guess what collagen is? Oh, it's only the basic building block of all of your connective tissue. And so if you have damage to a joint and you're taking something that's blocking collagen, what's the chance that your body can actually go in and do any repair? It can't. All right? So I'm not a big fan of the long-term use of NSAIDs. Second is the opioids. Well, we already know there's an opioid epidemic. There is a severe concern of abuse. If you mix them with almost anything, they can affect your heart rate and your breathing, and people die. So people become addicted to them. So there's a lot of negatives about the current treatment for chronic pain and inflammation. And CBD oil comes in, and it is 100% natural. It is non-psychoactive. All right, it's non-addictive, and it comes in and it can have a positive impact by reducing inflammation and reducing the perception of pain. And this is something that's really cool. We know that opioids, is once you start taking, your body can develop a tolerance to it, and you have to take more. And then eventually you have to take more. And it becomes this really awful medical merry-go-round where you just end up taking more and more and more of them. All right? And then you become addicted, and it's a whole nasty direction. If you have problems with that, I'm sorry. It's an awful thing. CBD oil may be a way to help. But this is what I want you to know. The research has shown that in all of these situations where they found that it helped reduce pain and inflammation, one of the cool things they found out is there was no indicator that people became tolerant to it. Basically meaning that it does not require more and more CBD oil over time to have the same effect. The truth is they could continue to take exactly the same amount and continue to have the same effect for a very long time. That's awesome. Meaning your body does not build up a tolerance to the effects of CBD oil. I think that's really cool. Something I've noticed clinically is people sometimes actually, as it brings the body into balance, they actually need less of it over time. You will never ever see that in a drug. And so I just think that's awesome. So what do we know? CBD oil, chronic pain and inflammation. Well, we know that inflammation is an out of balance response of the immune system. It's good at first, but then if it stays ramped up all the time, you're swelling, there's inflammation, there's redness, there's hotness. It settles in your joints. Your body doesn't like it. And you've got these two things, pain and inflammation. And we know that the chronic pain, How does CBD oil affect both of those? One, it helps balance the immune system so it reduces inflammation. Number two, it helps kind of stop the enzyme that breaks down one of your body's natural feel-good chemicals so that you perceive less pain in your brain. It's an awesome thing. But guess what? I would love to tell you that, like, if you want to really address chronic pain and inflammation, all right, you need a whole body approach, okay? You cannot, you just can't go at it and be like, you know what, I'm going to take CBD oil, and like 4 days later you're like, didn't work. I tried it, didn't work. I still have pain. I was at 10, now I'm an 8. I still have pain. It didn't work. You can't do that, all right? First of all, that's certainly not a long enough period of time for it to help. But second is you need a whole body approach, because this is what I want you to know. There are things that drive inflammation in your body that, you know, like bone on bone, that's bone on bone. Unless you get a joint replaced, you're not doing anything about that bone on bone. And, you know, if they've already done surgery, you're not doing anything about that. It's gonna be there, okay? But this is what I can tell you. If you have chronically high insulin levels, that's inflammatory. If you have chronically high sugar levels, that's inflammatory. If you're insulin resistant, that's inflammatory, okay? If you have digestive gut problems, that's inflammatory. If you have a leaky gut, that's inflammatory. If you're eating foods that your body has some intolerance to or sensitivities to, that's inflammatory. So the truth is that I'm going to tell you, I have a bone-on-bone ankle, all right? I mean, it is verifiable on x-rays. And it's been that way since I've been, 20 plus years now. But literally, 2 weeks ago, I ran a 10-mile trail run. Not like a flat trail run. Up and down hills, across creeks and mud, across trees, all kinds of stuff. And I've never been able to do anything like it. But this is what I want you to know. I was able to do that with the help of CBD oil. But I wouldn't have been able to do that with just CBD oil. I'll be honest with you. Because I found out a long time ago when I changed my diet, when I got the right supplements, I was able to, the knee pain that my wife had to rub, my wife doesn't rub my knees anymore. I'm kidding, baby. But she didn't have to rub my knees anymore. I don't have knee pain anymore because I cut very specific things out of my diet, and it changed my life, all right? So, the people I'm speaking to right now, this is why I created the world's first online health transformation program featuring CBD oil. Because I want to take all of that whole body approach, and apply it to you. If you have chronic pain and inflammation, and you guys know who you are, and you're like, you know what? I mean, I don't know what to do about it. I feel awful. There's a whole bunch of things going on. But guess what? If you have those things going on, you need a whole body approach, and that's what this program helps you with. I address CBD oil, what to take, how to take it, how much to take it, when to take it. I address this is how you need to eat to reduce your inflammation, to reduce your pain, to reduce that excess weight, the inflammatory hormones that are driving these processes. And then third, I give you, based on inflammation, there are also very specific supplements that help, along with the CBD oil, to help modulate the inflammatory response so that your body can get into balance. So if you want to know about that program, if you'd like to check it out, all you have to do is type in yes in the comments. You type in yes in the comments, and you will get a message in Messenger. And in Messenger, you say yes, and then you can click on it. You can opt in, and what it's going to do is there's a video of me explaining to the program. So just type in yes. All right, not give it to me. I like it though. Just type in yes, and if you type in, there you go, darling. You type in yes, and you're going to be able to get that program, see what it's all about, check it out. But listen, I'm going to tell you this. I'm talking, 20 years went into creating this program. I don't know how many hundreds of thousands of dollars of education that I went through to be able to put together, but you don't have to go through all that. I made it super simple, super easy. You can follow it. Just go on there. It has videos, just like the ones you've become used to watching me. All right, I do these. Guess what? This is exactly what the program is like on the inside. It's video after video of me telling you, do this, this is how you do it. This is the how, the what, and the why. How do you take your supplements? What should you take? How should you eat? When should you eat? What should you eat? What should you eliminate? Why should you eliminate it? And all that goes in there for this whole body approach, because this is the world's first online health transformation program featuring CBD oil. I could not be more excited about it. I'm so excited about it. I basically, my family doesn't even know what I look like this week. I have been gone for, I left the house at 7 this morning. It's 9 something tonight. I haven't seen anybody in my house. I miss them. I love you. But this is that important to me. So put yes in the comments. Just remember, CBD oil is a part of the program. So if you already sell CBD oil, awesome. You can do the program because you already get it. If you have clients that take CBD oil, they can still send them the link to the program, because they're going to take CBD oil and then follow the program. And inside of the program, it's going to answer a whole bunch of questions about CBD oil. And every video I've ever done on CBD oil, we're going to put that as a bonus in the program, so they're all in one place, so people that get the program can have access to them all the time. All right? So I'm just super excited. I'm trying to give you value, while at the same time I say, guess what? Guess what? You can do this program. All right? And this program has the potential to literally change your life. Thank you, Susan, for getting on. Susan is a complete rock star friend of mine. She's been a patient of mine for a long time. Metabolically changed her entire life, and I am so proud of her. Thank you for being on tonight, Susan. And she's a patient in my office, all right? Not online, all right? But I want you guys to know you have the ability to follow the same kinds of information that I've spent years putting together for patients in my office. You can do it online. Just type yes in there, and you can go in the opt-in, watch the videos, sign up, do it. I mean, I don't know how long I'm going to be able to allow it to be the cost that I put it on there for, because it's ridiculous, but I just want you to do it. It's going to be awesome. CBD oil for chronic pain and inflammation. It balances the immune system, so it reduces inflammation. Number 2, it blocks the enzyme that breaks down the joy, bliss chemical anandamide, and so it helps with chronic pain and inflammation. Once again, we don't diagnose or treat or cure any specific disease, but that's what CBD oil can do for you. Please put yes in the comments if you'd like to be part of a whole body approach to effectively address your inflammation, your pain, muscle pain, chronic muscle pain, digestive issues, blood sugar issues, blood pressure issues, insulin resistance. All of these things are able to be addressed inside of that program, because it's gonna make a change in the what goes in your body and how your body's balanced and how it functions. So put yes, and then that's it, guys. This is launch week, so I've been going live every single night. I apologize if it's an overload of information, but I just wanted to give you value. I value you, and hopefully I'm giving you value. If you got value from tonight, please just give me some thumbs up or some hearts, because I just want to know that you're getting something awesome out of this, because I'm getting something out of it. I'm getting your energy when you give it to me, so thank you. Go ahead, and we're going to end it tonight. So just like I tell my son every night, no, wrong, every day before he goes to school, be your very best today, hashtag never quit, and I believe that God wants the very, very best for you, and the day you believe that, it's going to change your life forever, just like it did mine. Have an awesome night.